So thank you so much, Kimberly, for joining. We finally figured this out. So this is
Yeah, sorry about that. I had some old information that I was going off of on the Google Hangouts.
no, that's okay. That's okay. This is our first Insta session. So I am Amita here from Nourish Talk, a global platform for natural and holistic therapies. We are starting our first Insta series with Kimberly, who is an acupuncturist and a dietitian. Today, we are going to be talking about PCOS, signs and symptoms, a simple 5 to 10-minute series we're going to start every Friday. So Kimberly, let's talk about what is PCOS and how do I know if I have a PCOS? So let's just talk about
Okay,
it. Thank you.
so PCOS is something that's unfortunately becoming more and more common with women, and PCOS stands for polycystic ovarian syndrome. And there's a lot of, the medical community has gone back and forth as to what denotes, meeting criteria to be diagnosed with this. But right now, there's 3 different factors that they look at to determine whether you have this or not. And one of them is irregular periods. Another one is actually having ovarian cysts. And the third one would be having an excess of male hormones like testosterone. Now, you don't have to have all 3 of those. If you have at least 2, then you currently meet criteria. So you could actually have polycystic ovarian syndrome without having cysts on the ovaries.
Okay. So what would be the different symptoms? Like, do I start feeling nauseous or do I start, I'm not a young girl, obviously, but as a young
You
girl.
don't have to be young to have PCOS. PCOS can affect a 15-year-old and it can affect a 40-year-old. It's really more, there's so much behind what it is. But, typically people think with PCOS, they think of the really common symptoms like painful periods or heavy periods, or facial hair, excess body hair. There's also, it's very common to have elevated insulin or blood sugar levels with PCOS. So a lot of times doctors will put these patients on a drug called metformin to help regulate the blood sugar levels. There's so many more symptoms, though, that people aren't really aware of that could be from, a PCOS. Things like hair loss, losing hair on your head, not the body, but on the head, is definitely related to having those high testosterone levels. And then, women with PCOS do tend to be on the heavier side because of the insulin issues. But there's where the weight is distributed is usually where you would see it on a man, like the upper body because of the testosterone and the androgens.
Yeah.
So that definitely, can be seen. But what's not known to most people is that women with PCOS can have the opposite problem. They can have weight loss. And that's because there's some lifestyle factors behind PCOS. Sometimes it's dietary, but other times things like stress play a big part into this disorder. And because of that, certain women respond to their high stress levels by actually losing weight. So don't think that PCOS is just for women who are a little overweight. It's not. You can be very thin and still have PCOS. Some other symptoms are like if all of a sudden you start noticing you're getting stretch marks, like in the belly or the thighs or the arm areas, because you have a recent accumulation of fat. And yes, I see a question. PCOS definitely can lead to infertility. Women with PCOS do find they have a much harder time getting pregnant. And that can definitely be one of the signs and symptoms of PCOS. Also, darkening and thickening of the skin can be a sign or symptom.
Where would be the darkening happen? Like on the face or somewhere else?
You can see it on the face, but the thickening of the skin can happen anywhere. It's part of that high androgen levels, which androgens are male hormones that, do that. They give our body more male characteristics. So, but yeah, like you can see the darkening of the skin definitely is common on the face.
Okay.
And what kind of comes into play with this too is just the general tiredness and fatigue. Depression and anger and irritability can also be a component of this. And, none of these symptoms in and of themselves are defining, but when you see the whole picture together, it can make it a little clearer that this might be what's going on. Unfortunately, we've also found that women with PCOS are more prone to asthma. And that's because with the PCOS, we have an increased amount of inflammation in the body, which unfortunately can lead to an increased likelihood of some type of autoimmune thing going on. And that can be part of the asthma. It's not with everybody, but there maybe if someone's, weak points in their body is their lungs, then that could come into play later on. Migraines and headaches can be another symptom with PCOS, especially around the period time, the headaches that are related to the periods. Also, diabetes is an increased likelihood with PCOS because of the insulin and blood sugar issues.
Which one comes first? Like if you're diabetic, then you are more prone to PCOS, or if you get PCOS, then you will get diabetes. Is there some kind of a...
Well, it can really go either way, but probably the more common route is they have PCOS and it eventually will lead to a diabetes if they don't take care of the diet and the blood sugar and the insulin levels. It's preventable, for sure. It's not like, oh, I have PCOS, I'm going to get diabetes. No. I mean, all of this can be turned around. So anyone who has been diagnosed with PCOS, I don't want them to feel like they've gotten, a lifelong ball and chain sentenced to them. It's not true. There's a lot you can do. And besides infertility, which we already talked to, unfortunately, if you have PCOS and you get pregnant, there is an increased chance of miscarriage with women who are PCOS. They have a higher risk factor for that. And so it's, something that you really have to be careful of. Also, if you are a young teenage girl and you're having problems with PCOS, it can impact your ability to reach your full height. So for girls who are younger in puberty and are already having this issue, it may stunt the growth. So it's definitely something that, you want to look into. Brain fog, typical to read a page in a book or a magazine, and by the time you get to the end of it, you're like, what did I just read? So that can be very common with PCOS. And then with PCOS, a lot of times stress is a factor. So you have the elevated stress hormone, which is called cortisol. And when it's consistently elevated, that will create changes in the body too. You'll get, let's say, you'll see like a really round face, we call that moon face. And not just the regular, like I tend to have a round face, but not something like this, but it literally looks like a circle. And also what comes with that is they can develop a small hump on the back and like a fatty patch in that area on the very, where the neck ends. So that's part of that high cortisol level too. Acne, and oily skin definitely come into play.
Facial hair sometimes,
facial hair for sure, and excess body hair, not just on the face, but other places that you wouldn't typically see more males have hair like that. But, women, even on the chest or the nipples, they might have a tendency to grow hair where women typically wouldn't. And then periods, they tend to have very crappy periods, like painful, long, excessive bleeding, that type of thing. And the last thing that swelling in the legs and feet can be an issue too with PCOS because of the hormonal imbalance.
Mhm.
And then also, if they're pregnant, besides having the increased risk of miscarriage, they're also more likely to develop hypertension during the pregnancy.
Yeah.
So, and that can play into other things down the line, like um, preeclampsia and stuff. So that has to be watched carefully as well. Um, And, you know, I do, like, my patients who want to get pregnant that have PCOS, I
Yeah.
really try to talk them into, like, getting all of these symptoms under control before, because they're
Sure.
much less likely to have any issues if they do that.
We'll talk
And then,
about that in next series. This is just
yeah,
an
for
introduction
sure.
series.
And yeah, and the last symptom that I want to talk about is that a lot of times women that have PCOS, they can have pelvic pain, you know, the lower abdominal pain, and sometimes sex during intercourse, there's a lot of pain as well. So
Yeah.
that is another symptom that maybe, you know, you may be having issues with this particular syndrome.
Okay. Okay. So any questions? You know, we are starting this series every Friday with Kimberly, and this is just an introduction to PCOS. Next session, we're going to be talking about a different topic. So, so if there are any questions, this is the first session. So please bear with us with the initial technical difficulties
Yeah,
we have.
sorry, I got it now.
Me too. I was, you know, this is my first time I'm doing the Insta live. We've been doing a lot of FB lives, which we become expert on,
Right.
but this is our first Insta live. So please let us know if you can't think of any questions or any new topics that you'd like us to cover. We will be covering every Friday. So with that, we'd like to sign off. Any final comments from you, Kimberly? We sign off, and we'll see
No,
everyone
we
next
are
time.
going to continue with PCOS next week,
Yes.
but a different aspect of what's, instead of just signs and symptoms, other things about it. So, yeah, if you have any questions, you can send the questions to Amita at Nourish Doc, and we'll make sure to cover those next week.
Great. Thank you so much, Kimberly, and thank you so much, viewers, for watching us. With that,
All right, guys.
bye-bye.
Take care.
Thank you.
Bye.